going to do the radial arterial puncture procedure. So once you receive the order, you want to make sure you have the right equipment, the blood gas kit, which has alcohol swabs, gauze, the syringe, the point lock device, and a biohazard baggie. You want to have a label for the baggie, non-sterile gloves, and mask and goggles if necessary. You want to review the chart, rule out coagulopathy. You want to make sure to identify any anticoagulants that the patient might be on. And you want to also check their coagulation time in their lab panel. You want to also assure stabilization if there has been a recent FiO2 or ventilatory change. A minimum of 10 minutes after that's happened, 25 minutes if the patient has a history of air-trapping lung disease. So when you go into the patient's room, you want to make sure you have the correct patient, of course. Introduce yourself by name and department and let them know that you're going to be taking an ABG. And then you're going to wash your hands and put on sterile gloves, non-sterile gloves. Okay, so this particular syringe already has 1 ml aspirated into it. And then you want to just check the patient's pulse on both sides. And you're also going to perform an Allen's test. You occlude radial and brachial arteries and have the patient make a fist until the patient's hand turns relatively white. And then you release the ulnar side. I said ulnar. And it needs to turn red in less than 15 seconds. And that will assure that if the one side is occluded, that the hand will still be able to get blood. So you want to position yourself by the patient comfortably. You're going to palpate and scrub the area using gloved fingers. You're going to move in a circle, so you start with a small circle and slowly scrub out, and then also scrub the fingers that you're palpating with. Don't blow on the area, wait for it to dry. You also want to open the gauze and lay it on the patient's arm. So you're going to palpate the patient's pulse with the dominant hand and hold the syringe with the other hand. It needs to be 45 to 60 degrees, and the bevel needs to be up. And the needle should be positioned parallel with the artery. You're going to let the patient know that you're going to stick them immediately prior, and then you put the needle in very slowly. Fill it until you feel resistance or until it gets to the 1 ml. Once you take the needle out, you want to apply pressure immediately for at least 5 minutes to decrease the chances of hematoma. And then after, you want to either use the point lock device or using the table method, place the cap onto the needle. And then you can actually take it out, make sure to get all the air out. There's a lot of air in this, but that's not how it would be in real life. So you would do the rock and roll, make sure you have the cap on, and then place it in the bag and place the label on it with your name and your login number and the patient's name, of course. Send it to the lab or do the test. And conclude the procedure, document it. Put the needle in the Sharps container. Is that it?